Welcome to The Younger You. Today on the show we're talking about probiotics. You've probably seen the word all over your grocery store and even in your pantry. But do you actually know what it means? Today we're going to find out. Let me introduce our probiotics expert, Dr. Canale. How are you?
How are you, Joy?
Fantastic. Now, we seem to think we know what probiotics are. What actually are they?
Probiotics are little microbes that seem to be beneficial for the host. So in the case of humans, they're bacteria that seem to be helpful for humans.
When you say the word bacteria, people think it's bad, but probiotics is a good bacteria.
Absolutely. So there tend to be good bacteria and bad bacteria. The good bacteria, the probiotics, actually help protect you possibly against the bad bacteria.
Do we naturally have some probiotics in our system without actually having to eat specialized food or take, tablets, for example?
We are actually carpeted with bacteria inside our intestines. They're helpful, they're beneficial, they work as kind of a protective barrier. And now it's an ever-evolving study of research in can we actually just put the bacteria straight in to be beneficial and help prevent certain symptoms and diseases.
Sitting at home, people go, I'm low on probiotics. How do we know?
No way to know, but what you do know is that your body just doesn't feel right. In the case of irritable bowel syndrome, you're going to have increasing abdominal pain, possibly bloating, gas, either constipation, diarrhea, or maybe going back and forth between those two without ever having a period of normalcy in there.
Do you feel that we overanalyze our system and our symptoms now? Because we all have access to the computer,
right,
and self-diagnosis. Is that just going a little bit too far now?
Possibly, and I think there's going to be people on either spectrum. Clearly, there are people that no matter how much it hurts, they're never going to go to the doctor.
Yeah.
And then there's the other end of the spectrum that something isn't perfectly right and they're immediately diagnosing themselves with cancer based on their research on the internet. So there is a wide spectrum, but I do think the more we talk about things, the more we'll get a better understanding of kind of the general lay of the land for most people. For example, something like irritable bowel syndrome. The good news is it's not life-threatening. It doesn't increase your risk of colon cancer. It doesn't increase your risk of infections. It doesn't increase your risk of dying early, but what it does do is affect the quality of your life.
I was about to say that it's your everyday life that it would be affecting by the sounds
Correct.
of it. Okay, let's take a look at two of the areas that probiotics can help us the most. Probiotics play an important role in your digestive tract. Our bodies need a healthy balance of good bacteria and bad bacteria. Poor food choices, among other things, can shift the balance in favour of the bad bacteria. Filling our diets with probiotics help keep the balance and therefore keeps our digestive tract running smooth. Probiotics are very helpful regarding our immune system. Our immune system is what protects us against germs. Having the proper amount of probiotics in our system can help ward off several ailments. What specifically are probiotics good for?
Some of the things that are actively being studied are the effects of probiotics in serious diseases such as ulcerative colitis, pouchitis, Crohn's disease, but also things like we were talking about earlier, irritable bowel syndrome.
So I look at this as they're my army inside my body.
Yes,
they're
sir.
in there fighting everything that we need to actually stay healthy and have a productive life.
Not necessarily fighting, but helping support the barrier.
Got you.
To prevent infections from taking hold.
Okay. Have we got different types of probiotics in our body?
Absolutely. There's probably...
You're probably going to tell me there's thousands of different types.
500.
Okay.
And we are looking closely at identifying certain strains of probiotics and where they appear to be the most beneficial, because it has become clear that there is no one super bullet. It is probably a combination of lots of different probiotics that are going to be the most beneficial.
People are sitting at home right now wanting to actually get on the internet and find out where they find this.
There's an expert panel of doctors that reviews all the latest studies in regards to probiotics. There's a great summary on your webpage of specific diseases or symptoms and the bacteria that have been shown to be beneficial in those symptoms, and also a ranking of how much data there is to actually support that. Working in conjunction with your primary care physician, never try to self-treat. Always work with a healthcare professional before you start yourself on probiotics. And then you will avoid the potential pitfalls of masking a more serious disease or spending a lot of money on something that doesn't actually need that.
There are so many probiotics out there. There's room temperature and refrigerated. What is the difference?
Well, for starters, convenience. If you're traveling, you don't necessarily have a refrigerator with you that whole trip. Taking a room temperature probiotic with you may be much more convenient during that trip. The advantages once you get into the refrigerated probiotics are it's more likely that the number advertised on the box is actually going to be the number you get.
So this is what I'm thinking to myself, is it the same amount of ingredients in refrigerated ones compared to the dry shelf ones?
We hope so, but we do know that everything does have a shelf life, and we know that that gets slowed down by refrigeration. So what you're generally seeing on the box is the number of organisms in there at the time of manufacturing.
Okay.
Theoretically, in refrigerated ones, it's going to stay closer to that number by the time you actually use the product.
I want you to show us a few here. There's different ones for men and women.
Right.
Is that normal?
It really depends on what you're using it for. Most of the studies involving probiotics focus particularly on certain strains for certain problems. Not all probiotics cover every potential problem you have. If you have something like vaginosis, a women's problem, you want to focus on the probiotics that have been studied to actually manage that problem, versus irritable bowel syndrome, which is found in both men and women. You might be able to use a much more general probiotic.
Okay. IBS is everywhere right now.
Absolutely.
Everyone seems to think they have it. What is the most common one that we could pick up from the refrigerated section right now?
Perfect. Well, you want to look at the ingredients, and that's one of the most important things in reading the actual bacteria on the back.
Okay.
You don't want to just pick a brand name. You want to look for certain strains of bacteria that have been shown to be beneficial in a disease like IBS.
What am I looking for?
Bifidobacterium is one of the better studied bacteria that seems to be helpful in irritable bowel syndrome.
Okay. And once I take those probiotics for that symptom, will that fix that problem?
We hope. One of the most important things that we look for in management of a problem is actually sticking with it for a while. So you have a lot of acid in your stomach, and these bacteria need to be given in a high concentration and a high number to get through and past that acidic stomach contents so that they can establish a healthy colony in the intestines. And that generally is about 10 days out from the time you start the treatment.
This is a healthy way of doing it. Do you believe that this replaces something that a doctor would prescribe as a medication from the chemist?
That's a good question. I think because something like irritable bowel syndrome is not known to be life-threatening, we want to make sure that patients are, one, not misdiagnosed, and make sure that they're not masking another more serious disease.
Exactly.
However, if you are diagnosed with something like irritable bowel syndrome, starting with a treatment that most patients feel is not chemically altered, it's natural in the environment, is very refreshing to my patients. And so they often suggest and want to go down the road of probiotics. And in irritable bowel syndrome, it's a wonderful match of disease and possible treatment options.
What are some other symptoms out there or issues with your health that probiotics work and help and enhance?
So we are still very much in the infancy of understanding how much probiotics can happen.
But I've been hearing about it for 15 years.
What we know is that yes, they have potential. What we don't know is how great that potential can be and how diverse the organisms that you take in need to be. What we do know is for something like ulcerative colitis, a very serious, potentially life-threatening disease, probiotics can help maintain remission.
Wow.
And so in something like that, it's really important, one, that you have the right diagnosis, two, that you're following up with your physician, and three, if you choose to be on it, you're doing it in a concerted manner in conjunction with your physician, but yes, they can be beneficial.
So we've covered the refrigerated.
All right.
It's basically the same as the room temperature, isn't it?
Read the ingredients. The shelf life of the refrigerated more than likely will be a little better.
A little better, okay.
Unfortunately, these are supplements, so they're not necessarily FDA regulated, and it could sit on the shelf for 2 months, and if it's been sitting on a shelf under a hot light, it probably has less active bacteria in it than the equal product that has been refrigerated.
If you want to find out more information about FDA regulation with the probiotics, head over to our webpage at theyoungeryou.tv and we'll have it on there for you. Do you know what probiotics are?
I do, actually. Yeah.
Probiotics are good bacteria and things like that that help keep the bad bacteria away, essentially.
It helps you to digest different components in your body.
The friendly flora in yogurt and kombucha, sauerkraut.
Why do you feel that they're important in everyday diet?
I actually feel it's really good for your immune system, so that's kind of why I do it, little steps to make me a little healthier.
Do you feel it's an everyday occurrence that you need probiotics in your diet?
I'm not sure you need them all the time, but I don't think they hurt.
What do you take as a probiotic every day?
I try to take it in this form, at least so it's somewhat enjoyable. I can't take a pill, but yeah.
Vinegar. I've sought out vinegar with live mother bacteria.
I take a probiotic supplement. I do the enzymatic drinks, yogurt.
Do you feel probiotics are a part of your everyday life, including your children?
Yes. Yeah, I always give them their sauerkraut.
Yes, it's very important for my kids to have the right amount.
At what age were you when you found out about probiotics and how important they were for your everyday diet?
Probably about 2 years ago, so when I started to look at my health more, but yeah.
What made you look at your health more?
Actually having an autoimmune disease, so I started looking at probiotics as a healthier way to maybe not take a pill.
So we've done the supplements. What is the next best thing if you're not interested in supplements? Dairy.
Great source of live probiotics. So yogurts and what you're holding there, kefir.
Yeah. Okay.
So that's a really interesting product. It was, rumor has it, founded by shepherds in the Eurasia Caucasus Mountains many thousands of years ago. And what it is it's a fermented milk product.
Okay.
These shepherds were carrying their milk and they noticed in the heat it would start to develop bubbles, carbonation, and it is loaded with probiotics.
So is it better than the supplements or the same, similar, what you were saying about how many's in there?
Correct. And so you really...
So it's dosage?
It's dosage.
Okay, well I'm going to have a try of this.
Great, man.
I've never... Oh, really?
No, it's delicious.
We'll see. So I'm going to have a taste. Bottoms up, people. Oh, it's like yogurt.
Yeah, exactly.
That's all it is?
Yeah, fermented dairy product, and that's a good...
Why was I thinking it was really going to be really quite bad?
No, it's quite delicious.
Actually, it is quite nice. Okay, what happens if I drink this whole bottle? Dairy overload?
Possibly. You know, one of the nice things about some of the fermented dairy products is some of the side effects that we see from dairy, which is really the fermentation of the sugar molecule in there, lactose. The bacteria help break that up. So in the fermentation process, a lot of that natural lactose has already been digested by these bacteria. So it often has a lower sugar content, and therefore for patients who don't tolerate lactose well, often they can tolerate yogurts and fermented dairy products a little better than they would, say, ice cream or milk.
Okay, where are you taking me now?
So I think we could walk down and take a look at some of the other natural fermented sources of probiotics that you can find just on your normal table.
Okay, perfect.
Great, let's go.
So here we are in another aisle of Whole Foods supermarket, and you were saying sauerkraut? I would never have thought of that.
So fermented vegetables that are not fermented or pickled with vinegar. That actually takes away the natural probiotics that happen from the fermentation process. So you want to look for something with salt and water, and then you're going to get a great source of probiotics naturally. So things like sauerkraut.
But
excellent.
It actually says on here, organic, raw, and probiotic.
They're selling you the actual live organisms that naturally happens in the pickling process of sauerkraut.
What am I looking for on the back of something like this?
Most importantly, you want to see that you're not seeing anything that says vinegar, because then the pickling happened through the vinegar process, not through natural fermentation.
All right. Okay. Now, red miso, soy paste.
Fermented. So it's fermented soy It has a wonderful salty, kind of nutty flavor to it. Miso soup's a wonderful, warm, kind of soothing thing, but it's a great source of probiotics.
See, funny you say that, because every time I go to a Japanese restaurant, I think to myself, should I be eating that? Is it bad for me? Is it too salty?
It's wonderful. So it's actually, the fermentation process contains a lot of probiotics, and it has a great natural source of probiotics for you.
Go easy on it though, don't be drinking too much of it.
Look at the sodium content. If you're somebody who tends towards a really high blood pressure, yes, but a lot of the natural flavors and the saltiness isn't actually from salt, but a salt-like substance.
All right, what's this one you've got down here?
Tempeh. It's a great meat substitute.
Okay.
If you have a vegetarian, if you want to make tacos, if you want to make other meat substitutes and stir fry and pasta, tempeh is a fermented soy product that actually is firm. It's got a texture consistency with meat and with chicken, and another great source of probiotics.
Dr. Canale and I have brought back some of the probiotics that we picked up in the supermarket, but just looking at these few that I've got here, Dr. Canale, it's already confusing. How do we know what is what and what is good for us? We need to break that down a little bit. What's the first one we have here?
This is the ultimate probiotic, and I think one of the most important things when you're looking at a probiotic is actually reading the ingredients. The number of bacteria in there is important, and also the strains of bacteria. Certain strains have been studied to be more beneficial in certain symptoms. So for example, this one has some bacteria in it that may be helpful in preventing antibiotic-associated diarrhea and possibly irritable bowel syndrome symptoms.
Okay, so you've got the Primal Defense Ultra Ultimate here. How is that different to the one that you just were talking about?
Again, it's going to be the strains of the bacteria that it has in there. Something like this is a very diverse probiotic that theoretically can cover lots of different symptoms. It's kind of the shotgun approach.
Okay, so, well, and sometimes that's good and bad, because if you're trying to cover everything, you're diluting something that you could be needing more of.
We hopefully are not doing any harm is the first and most important thing, but if you have certain symptoms, you should try to choose a probiotic with your healthcare professional that may be best for treating those particular studied symptoms.
Okay, this one, Probiotics Complex Plus 365.
The ingredients in this will be more specific for helping probably irritable bowel syndrome.
Got you.
And it's much more focused. It doesn't have 20 different bacteria in there, it has 2.
Well, this to me looks like a smaller box, and I think to myself, is that just as good as that box?
The price of these vary dramatically, and if you really are trying to focus on irritable bowel syndrome, then you probably should just be focusing on taking the products that are studied to possibly help.
Okay, so this one looks like it's a huge word. What is it?
Saccharomyces boulardii. That's the name of the organism, and one of the places where it's shown to be potentially more helpful than others is in preventing antibiotic-associated diarrhea.
Okay, this one here, VSL number 3, it looks more medical.
This is a medical food.
When you say medical food,
it's regulated in a little different way by the FDA, a little tighter controlled. One of the benefits of this is it's been really well studied in inflammatory bowel disease and has been shown to have some benefits there. So if you're working with your physician, that may be a good option for you.
You were talking to me a few days ago about another treatment. I want to make sure it's said the right way.
A fecal transplant?
Yes.
Okay. So there's a bacteria called Clostridium difficile, and it can cause an inflammation of the lining of the colon that causes potentially life-threatening illness, fevers, abdominal pain, profound diarrhea, dehydration. This has been a very difficult bacteria to treat. One of the things that we can do that has been very successful in treating resistant Clostridium difficile colitis is actually to take a healthy, theoretically family member or relative's stool for a day, stick it in a blender, and then for the sick patient to actually infuse that other person's feces into their GI tract, and it's been incredibly effective at treating what's been a very difficult bacteria to eradicate in some people.
Is it something that the general population is available to use?
Absolutely. So if you have a resistant, difficult to eradicate infection with Clostridium difficile and you have failed multiple courses of different antibiotics, the next step your healthcare professional will probably recommend is to consider getting a fecal transplant.
Okay, well, if you want to find out more information about this particular service, head over to our webpage at theyoungeryou.tv and we'll give you all that there. Probiotics are an easy and effective way to maintain your digestive health, immune system and so much more. For more information about the products we've discussed today and about the show, please visit our website at theyoungeryou.tv and I'll see you next week.